Good afternoon. Today I'm joined by State School Superintendent Chris Rakedahl, Edenville Schools Superintendent and President of the Washington Association of School Administrators, Creston Barr, Health Secretary John Weisman, and Senator Lisa Wellman. We cannot hide from the central truth of this moment. We know that COVID-19 is at least 10 times more dangerous than the flu. And anything less than strong action amongst all of us is not appropriate or up to the task that we face at this moment as a state. Our state has been taking bold and aggressive actions against COVID-19, including workers who are telecommuting, business leaders and public and private partnerships and nonprofits who are helping in so many ways in this efforts, people who are caring for their families, doing the things that are smart, and multiple government agencies who are working together on this challenge. And today we are taking another such action. In order to mitigate the impacts of COVID-19 in our state, today I make the very difficult decision to order closures of schools in Snohomish, King, and Pierce counties. This includes public and private K through 12 schools. Under this order, schools must close and end classes by the end of this coming Monday. The first possible weekday back will be April 27th. This 6-week closure is not a decision made lightly. This came after many discussions with Secretary Weisman and his team at our State Public Health Authority, Superintendent Rakedahl, superintendents from districts of multiple districts that will be affected, many parents, county executives from each of the counties, the Washington State Education Association, PST, and others. We have reached a tipping point where the spread of this virus demands that we take action. We're seeing the number of confirmed cases within the Puget Sound area increase significantly just in the last week. And we do not expect this to slow down and will not slow down unless we take action to defeat this virus. Although this virus presents much milder symptoms in children, health professionals have told us that closing schools could create a significant cut in the peak number of ultimate infections. And closing school districts will help slow the transmission of this dangerous virus. School districts within the region are also experiencing unparalleled student absences even today. Many districts are also struggling to staff their operations. And during times of uncertainty and risk, we all need to make tough decisions, and this is one of them. Something of this magnitude cannot be surmounted without all of us pitching in. I've already asked businesses in the Puget Sound to expand options for telework, and with school closures, those options become even more important for parents who have children who will be affected by this order. With that being said, there are critical services our schools provide that will need to continue during this closure. That includes nutrition and child care. I've asked the superintendents from King, Snohomish, and Pierce counties to have a plan for the continuity of these services. Nutrition services for students who rely on school meals and support for students experiencing homelessness. Based on what we are hearing from OSPI and other partners, we have every reason to believe that we will be successful in this regard of providing services to these children in need. We are in talks right now with philanthropic and service organizations ready to help students impacted by these closures, such as distributing boxed lunches. This effort may also ultimately involve our National Guard. I've also asked for a plan to provide opportunities for extended learning, similar to packets that teachers send home on Thanksgiving and winter breaks. Now, we know that districts vary widely in their capabilities to provide these tele-education systems outside of the classroom. Therefore, schools should not be providing online services unless it really is effective, and we hope that it will be. As I've said before, closing schools has a major impact on our ability to staff hospitals and other emergency service providers crucial to public health crisis if in fact we do not provide adequate child care for the children of these employees. We absolutely cannot afford a situation of healthcare providers not working in hospitals because they do not have adequate child care. During these closures, I've asked superintendents to provide child care at no cost to families who are in the medical field or who are first responders. This is extremely important for the health of Washingtonians. We simply cannot afford health professionals and first responders who cannot do their duties. People should understand nothing in this order precludes public, private, or charter schools from using their facilities to provide child care, nutrition, and other social services. If a school in any of these 3 counties is open and providing child care, it is my expectation that staff will take every measure possible to provide social distancing, ensure consistent hand washing, send students home if they're sick, and routinely disinfect commonly touched surfaces. I think now is the time for us to come together, and I encourage local education associations to work with their superintendents to be as flexible as possible within their collective bargaining agreements for the safety and health of students and staff. I want to repeat, these closures are limited to the 3 counties named, but it's very important for all school districts across the state of Washington to have very active, robust, and meaningful plans for contingencies that may include them in future closures, and those could come in the near term. We are aware that other counties may end up becoming part of this effort, and we may be making similar decisions shortly. I will use the same criteria for closures that we've talked about: the number of cases in the affected counties, the ability to perform contact tracing of people who are infected, student and staff attendance. And I'll use that criteria in determining if action is required in additional counties. My emergency proclamation includes the flexibility to take further action in other counties, and that's why we need our districts across the state to be ready as soon as possible. So I trust that districts in the rest of the state will be having conversations with their communities in this regard to be ready. We know that with every step we take, our top priority is reducing the number of infections and deaths. And I know the school districts will be sharing their plans in coming weeks with their families. With that, I'll turn this over to Chris Richtel, who's been doing a great job in our planning process. Thanks, Chris.
Thank you, Governor Inslee. I'm Chris Richtel, State Superintendent of Public Instruction. I want to say first off, our kids have been very safe in our schools through the duration of this process and the duration of this viral outbreak. Early indications from our health officials made clear to us that that was the safest place for our kids, and it remains a very safe place for our kids. As the governor indicated, the infection rate for young people is very low. Their incidence of being symptomatic is very low, but things change. And as we understand more how this unfolds, it is important that we keep the health not just of our students, but their parents, their grandparents, and the overall communities in our minds. And one of the protective ways we can do that is to take the bold actions that the governor has just indicated to ensure that we have every focus in the world at the social distancing strategies that ultimately protect our entire community. I say to young people when they ask me about this, you may not ever be symptomatic, but if you are a carrier, you may be putting your grandparent at risk, and there's a time to take more significant action. It's a very different world than it was just a week ago or a couple days ago. We have 15 districts in the region that have announced closures. They've joined districts who had already had short-term closures. These are, this closure, as the governor has indicated, is up to 6 weeks. It involves 43 school districts in those 3 counties. It is roughly 600,000 students. It is more than half of our student population in the state of Washington. It begins, as the governor indicated, no later than the end of the school day on Monday. Districts have asked us for a little time, in some cases, to prepare. They still have the local choice, of course, to close sooner than that. It ends on April 24th. That's a Friday. That means Monday is likely the first back-to-school day, but we will constantly review that based on the governor's leadership, his Secretary of Health, and the feedback that we get about the spread of the disease. Very low incidence of cases in other counties, and I think we all expect that to change as testing increases. Now is the time to prepare for that, to prepare for child care, to take those necessary steps as school districts, if not already, and we are confident they have. Engage your local public health. Make sure you are prepared now that we have a lot more information to make decisions more quickly. Student attendance in the 3 counties affected has changed significantly. We have experienced an 82% increase in absences in King County alone. It doesn't mean 82% of students have been absent. It's an 82% increase from 6.2% to 11.2% in a very short period of time. Some districts, their absences exceeded over 20%. Schools in Snohomish County had a 56% increase in absences in that time, and Pierce County a 13% increase. And let me just say right now a thank you to the governor for being really bold here. Pierce County does not appear to have as much infection right now. That's exactly why you make this bold decision in an area where we think it is very plausible the numbers will grow, and that's why he's made clear that he will use additional criteria should the need for other counties to be included. But right now, these are the most impacted areas and the places we can get ahead of this. Staff attendance is down. We have a disproportionate number of our bus drivers and our substitute teachers who are over the age of 60. And you've seen indications from local public health officers to take special care to protect them, as those numbers of adults have found themselves unable to come to work or made the smart choice not to come to work. For some of our districts, it's been nearly impossible to have a continuity of services. And when you get to that place, you then have a very inequitable public education system. Guidance released by our public health officials, again, focused on over age 60, and we've seen the impact from that. Statewide, more than 16% of our certificated staff are over the age of 60. So not just bus drivers and substitute teachers, but 1 in every 6 teacher-coordinated effort. The outbreak continues to expand. Secretary Weisman has been remarkable in keeping our K-12 system through my office updated on the numbers. You've seen those numbers. You've seen where they are located. I want to make clear to folks who might have been thinking this is like a flu. You've heard public health experts say consistently this is not the flu. We don't have a vaccine for this, and the expectation at this point in time is that is quite a ways out. So when the governor makes this decision, and we partnered with him in helping him understand the implications for schools, it's also under a belief that our systems need to be prepared for a potentially longer closure in the near term, and the possibility that without vaccine, as we have seen in pandemics of past, strategies and professional development to get our staff and faculty prepared for a lot more learning that may happen at a distance. That is not a mandate of the current. We have amazing public health experts and folks at our universities and the CDC who could initially map the contacts that individuals are having with people when they were diagnosed with COVID-19 or they were tested and confirmed. That becomes very difficult with the kind of numbers we're now seeing in King and Snohomish and increasingly Pierce County. These are some of the reasons of what's changed. Many of them will be on spring break during the duration of this closure. It gives us a really important opportunity to minimize the learning loss for students. But we want all districts to think about next week as a spring break. And the public should not expect that we have these services fully stood up immediately. Districts need time. Their food distribution systems are in order. We are prepared. We have been building for this moment very rapidly in the previous few days, and all the bargaining units locally to double down in their effort to support and love kids as they always do. And that means working with their superintendents over the next week. This is a labor management joint effort. And if you've ever observed a teacher, most of you have them in your family, you know they will run through walls for students, and we expect nothing less in their effort to cooperate here. Everyone needs to be communicating with students and families consistently and regularly. We intend to keep our apportionment system going. I'll be clear and get rid of that term. We're going to keep sending money to our school districts. There is an expectation that with the way we need to deploy these services and continue to have supports, it will still include transportation potentially. It will still include supporting individuals. That means there is an ongoing need to private employers to continue compensating employees and finding meaningful work for them when they can. This will take an enormous economic impact to our state, to our region, and ultimately to the nation. The school system is $1 billion a month compensation system for professionals throughout the state, and we intend to keep that compensation flowing so that we are not a contributor to the economic